Good afternoon, dear patients. Today we will discuss a clinical case presented in the picture. This is allergic balanitis. Balanitis is inflammation of the glans penis, that is the skin of the glans. Although many patients think that it is a mucous membrane, in fact it is skin, albeit quite thin. It is precisely this point, including the fact that bacteria often accumulate there on what is called smegma. Smegma is produced by the sebaceous glands, which are called Tyson's glands, located in the area of the glands and foreskin. All of this contributes to the fact that allergies manifest there first and foremost. I'm not saying that the widespread obsession among, frankly, not very knowledgeable doctors and patients that any redness on the glands is definitely a yeast infection. This is essentially the paradigm, the dogma that leads everyone to apply ointments like clotrimazole as a matter of course. In fact, in most cases, there is no yeast infection at all, just as in the case we're discussing. A young man, 24 years old, came in complaining that after sexual activity, the glands of his penis would become especially red, most often in the same spots. Accordingly, tests were taken for sexually transmitted infections, including the much maligned Candida yeast. In this case, you should not wash the glands, as I constantly tell my patients when we are taking tests. In this situation, it is essential to take samples from the glands of the penis, which is only natural, but this is not done in ordinary laboratories. That's exactly why you need a doctor in the first place. Many patients come to me with certain test results, and we often have to redo them because either they were taken incorrectly at the wrong time or they were the wrong tests altogether. In this case, tests were taken for sexually transmitted infections and a bacterial culture from the glands of the penis, but this did not really lead to any progress. Next, a blood test for sugar was performed. The smear imprint was taken from the glands of the penis. These test results were also normal. A complete blood count and an allergy test were performed, which in particular revealed that the eosinophil count in the blood was elevated, almost 3 times higher than normal. In addition, the eosinophilic cationic protein and immunoglobulin E were also elevated. This indicated firstly the underlying allergic etiology and hypersensitivity nature of the disease. And secondly, it provided further clinical confirmation that when the patient was using latex condoms or certain types of personal lubricants, similar rashes would significantly worsen or reappear on the glands of the penis, despite the fact that he was having intercourse with the same sexual partner, who, by the way, provided test results for sexually transmitted infections. Those were also negative, as a result of which the patient was referred to an allergist for consultation. He was diagnosed with food intolerance, specifically a food allergy related to immunoglobulin E, and accordingly, certain abnormalities were identified and managed by an immunologist. Dermatologically, sodium sulfate, calcium gluconate, and vascular medications such as doxy and omtrentala were prescribed. Topical therapies were also prescribed, including ointments, cold compresses, and so on. As a result, the patient made a full recovery, in light of the fact that the patient still occasionally experienced at least some slight inflammation and redness following sexual intercourse. It was strongly recommended that he carefully evaluate the potential option of undergoing a circumcision. You can find out what that is in a separate video on our channel, so for any redness of the glands, you can consult the dermatologists and venereologists at our medical center, paid KVD, in Moscow. Don't assume that redness of the glands is always caused by Candida. It's better to consult a doctor if you're not sure that it's just some temporary external factor. We look forward to seeing you at our clinic, and don't forget to subscribe to our YouTube channel and our Instagram channel. Thank you for your attention.